Among the most common shown symptoms of prostate cancer is rectal bleeding. This bleeding often occurs in the rectum located just below the prostate. Bleeding from the prostate. Early detection of often asymptomatic prostate cancer increases treatment options, enhancing survival and quality of life. So what are the treatment methods for prostate cancer?
Prostate cancer is one of the two most common types of cancer in aging men. The diagnosis, treatment, and follow-up of such a frequently occurring type of cancer are, of course, extremely important. A urological examination, which we refer to as a rectal examination, is also extremely important for the early diagnosis of prostate cancer. PSA is important in early diagnosis. If you notice any changes or an increase in PSA levels, what do we do then? We perform an MRI on the prostate, or we conduct a prostatic examination using transrectal ultrasound or microultrasound technique. If a suspicious lesion is found, then we proceed with a prostate biopsy, which we call a fusion biopsy.
The most important determinants of prostate cancer treatment are the stage of the disease and the risk group of the patient. Patients in the initial stage and low-risk group can be treated without surgery.
If a patient, regardless of age group, falls into the low-risk category, the Gleason score will be low. The PSA level will be low, and the number of cores in the biopsy will be low. We can perform robotic HIFU on these cases. In these early stage or low-risk prostate cancers, this is not a surgical method. It is actually a minimally invasive method. We are talking about an outpatient procedure, but performed under anesthesia in operating room conditions with an average duration of 45 minutes to 1 hour. Especially robotic radical prostatectomy, of course, is extremely popular and considered the gold standard method, and we have been performing this method for 15 years. However, the emergence and adoption of this method, particularly for the low-risk group, will allow this group of patients to avoid surgery. Therefore, we will have implemented a treatment model with simpler methods without affecting the patient's quality of life.